One of my beliefs is that as we are going into this potential situation where the COVID-19 comes here, that we be as prepared as we can, and that we all have as much information as possible about what we're doing and what we need to know. And so I thank our community partners for being here with us also.
The COVID-19 or novel coronavirus is a newly emerging type of coronavirus. Coronaviruses normally circulate in Kentucky, other types, common ones, during this cough and cold season. So that's not uncommon, but this is a new one that has the potential to have economic and health impacts here in Lexington. And what we know about it is we think that it's spread very similarly to other respiratory illnesses like influenza. So that would mean that it's spread when people cough or sneeze, that they get it that way, or they touch an object where the virus has been deposited by somebody who's coughing and sneezing. We think that the incubation period is about 2 to 14 days. That's the period from when you're exposed to the period that you actually start to show symptoms. We think that this is a disease that has a mortality rate that's higher than regular influenza, but lower than its cousins, which are also coronaviruses like SARS and MERS that you may have heard about that we have dealt with in the past 10 years. We think that it's more contagious than influenza, but less contagious than diseases like the measles. Those are the things that we think we know based on data. Most of our data is coming from China. We don't know about whether common antivirals that we use for the flu or that some people use to control HIV may be effective with this particular virus. We do not know whether it will have a seasonal component or not. We have told folks that our main message right now is the same message that we would use for any type of respiratory infection, and that is wash your hands, wash your hands, wash your hands. Okay, first of all, stay home if you're sick, sneeze into your sleeve or into a clean tissue, and disinfect surfaces as you normally would, especially high-touch surfaces. Those have been our main messages to the public. I do think that we've been discussing this morning strategies that would include containment, which is early identification of cases, and potential isolation and quarantine of cases or people exposed, but also mitigation strategies to try to limit the spread of disease once spread is more community person-to-person transmission. So once it gets widespread, we will be talking about people and emphasizing that people who are mildly ill stay at home to not overwhelm the healthcare system. We will be emphasizing that people who are potentially exposed also stay at home of their own volition. And we will be talking potentially about other social distancing, that's just a fancy term for meaning staying away from other people, types of strategies. And those could have, again, impacts, economic impacts on families. They could have economic impacts potentially on businesses in the community. So we need to think about all those things in order to limit the spread of this disease and limit potential mortality here in the city.